Thank you. I am delighted to join you here today. So I am going to talk about walking the talk. And that is code for leadership. Means talking about people who are willing to do what they're asking. So walking the talk. You will hear that weaved throughout my talk today. Before I get going, though, I want to say thank you to a few things. I want to say thank you to Social Solutions and the sponsors of this conference to give us the opportunity to share our experience, strength, and hope. It is so important that we have this conversation. Whatever those conversations are to help us do no harm and to get better is really, really important. Today, the Children's Service Fund Board has 2 board members here. And I am so proud and I'm so grateful that they took the time to show up today and to learn more about performance management. Mr. Terry Crow, our board chair, and Ms. Joan Berry, our board secretary, thank you, and thank you to all of our board members. I want to thank the staff of the Children's Service Fund because they're just completely awesome, and I wouldn't be here today without them. So I thank them, and I thank all of you. I look forward to hearing from you and learning from you over the next couple of weeks, or the days, excuse me. So I'm going to talk about 3 things. I'm going to talk about a grassroots effort that we passed in St. Louis County. I'm going to talk about the Children's Service Fund, and I'm going to talk about performance management. But before I go there, I'm going to tell you a little bit about me and my history and background and how that has helped shape me to be the kind of leader and the worker that I am today and in the role that I'm in today. I grew up number 6 out of 9 siblings. So we grew up in the 50s and the 60s and the 70s, quite a long span. We were typical. We grew up in a tree-lined street. We rode our bikes. We went on picnics. We went to Mass. We raised the flag. The thing that was different about our family is my mom's chronic mental illness with a psychotic feature. In 1950, that was very young in terms of how to treat it and understand what was going on. And as you know, being in the field, whenever there is an absence of information, people will try to fill it in to help feel safe and to understand what's going on. So many well-meaning relatives, no malice intended, blamed it on her children. And they would say things like, dang, if I had that many kids, I'd be crazy too. They must be crazy for having that many kids. Well, we understood shame, stigma, and the trauma of being raised in untreated mental illness firsthand. But I also learned there passion, determination, persistence, and compassion. That those attributes coupled with my own wellness journey, as well as my professional development, eventually as a licensed clinical social worker, treating people, working with people with mental illness. I became the clinical social supervisor of a large family organization that had 7 counseling and psychiatric sites. And today I am a funder of mental illness, mental health, and substance abuse services. So I've come full circle. And that experience has really shaped my determination that individuals who have mental illness and substance abuse services get quality and effective services. So a little bit about me. I'm going to shift now to an initiative, a grassroots initiative called Putting Kids First. And as you know, and it's been talked about somewhat here today, some of the most important public policy that we have in this country have come from non-for-profits advocating for their causes and lobbying for their causes. And I've had the privilege of working with a number of non-for-profits that actually have advocacy in their DNA. And I'll give an example. In Missouri, and across our country, really, mental health and substance abuse services are not designated, nor are they mandated for a state or a federal budget. So talk about economic insecurity. Those have been the first on the chopping block forever. So Missouri's answer to that and that was come from our non-for-profits working with the legislators, was to create a piece of legislation that gave local communities the option to try to get a continuous funding service for mental health and substance abuse. They created a piece of legend called the Community Children's Service Fund. It funds mental health and substance abuse services in 10 specific service categories. You can create the fund either through a sales tax or a property tax, and you can ask up to $0.25 cents. St. Louis County, we have about 1 million people. In the target population, it funds services for kids 19 and under. Our target population, there's about 250,000 kids. The next largest county is about 65. So we've got the largest population of everything in the state. So in 2005, a number of non-for-profits, 5 of the leading non-for-profits in St. Louis County, that have that advocacy in their DNA, their very genetic component, they decided, and we had seen just a deep cuts in mental health and substance abuse services, particularly for kids, doing just tremendous harm. So as the 2007 came up, looking at 2008, they got together and they said, you know what, we're going to try to think about getting this to happen. So they did some polling information, and they did a needs assessment to document. We knew the need existed, but just to really document so we could go tell the story to the people. And indeed, there was a need, and the polling information came back, and that was a telephone survey, right? The telephone survey, we asked the individuals, the voters, listen, out of these 10 service categories, what would you push the button yes for? What would make you say yes? And they came back resounding saying, we do not want our kids homeless. We do not want our kids using drugs and alcohol. And we want abuse and neglect to stop. You get that to happen and you got the money. So these 5 non-for-profits said, it not only is it the right thing to do, it's the right time to do it. They asked me to lead the campaign, and I said yes, absolutely, I would do that. And that was completely ignorant. I'll tell you, it was the grassiest grassroots campaign ever. There had not been a successful petition drive since 1950. There was no template. But I can tell you this, I can write the chapter on petition drive for dummies now. We needed 43,000 signatures to get it on the ballot. And we were able to collect 51,000 signatures to do so. We were very wildly successful. We organized, and it was probably no mistake that I read Malcolm Gladwell's book, The Tipping Point, and was able to use some of those strategies, and it worked. We went to civic groups, we went to women's groups, we went to every place that we could to collect signatures and to educate the public about the need, the gap in services. And we got so good, we were going to fish fries left and right. They started calling us the Cod Squad. So, we really had a blast. It was a lot of fun. But I'll tell you this. We thought we would have to tell a lot of stories. We thought we would have to tell people in the community about the need. And the truth is, they knew it. They told us their story. They said, the kid down the street isn't getting services. We know my brother, my sister, my aunt, my uncle. People knew it. What we were asking for was $0.25 cents. So what that meant is for every $4 spent in St. Louis County, 1 penny was going to go into a bank for kids to provide funding for these services. We passed this. We not only earned our spot collecting those signatures on that ballot, but we also passed it with 62% of the voters' approval. It was huge. There's 91 municipalities in St. Louis County. We only lost in 1. And I'm not that ashamed. It was 49.5%. People came out, and we had no money. This is non-for-profits. It all came out of our pockets to fund it. It was just a huge community success. As we collected a lot of signatures in churches, and as we were in those churches, I began to think, what would we do if we win? Because this is a lot of responsibility. That's $35 million a year annually for these services. And that's Yahoo, but I'm telling you, the responsibility weighs heavy. We made promises, and we have to deliver on those promises. So this is what we're doing to walk the talk in St. Louis County. As soon as the board was selected, we did strategic planning. Before we operationalized anything, we called David Hunter in. And we created a theory of change, the blueprint, the action, how are we going to really make this hit the road? Our business model is called Malcolm Baldrige, the 7 criteria for performance excellence. If you've not heard of that model, scribble it down. It is the only framework that's been normed to measure non-for-profit effectiveness, both nationally and internationally. It's a systems approach. It drives the organization and aligns the organization to doing what matters through visionary leadership, through customer focus, consistent measurement, an engaged workforce, and systematic processes. It's performance management on steroids. It is really, so that is our business model. We have also purchased efforts to outcomes. And, as a funder, I was able to utilize that performance management data software as direct service. And I want to tell you, it made all the difference in helping us understand what we were doing clinically and what we needed to change and what we needed to continue to do. It really gave us a GPS to understanding how to really be effective clinically and really drive the organization tactically as well as strategically. So now having the opportunity, and we've been on business now 2 years. We're going into our second funding cycle. So we really, utilize spreadsheets and that sort of thing to figure out what we need, and now we're implementing, and gratefully so, for our next funding cycle. So we have the ability to start to track. And remember, this is walking the talk. We're funders now. And we want the folks that we invest in to do the same. And the truth is, in our first funding cycle, we funded 44 agencies, 90 projects. They're at different levels of risk. There's some agencies that are not very sophisticated at all. In fact, we're teaching them how to track their outcomes on spreadsheets. And then there's some that are much more sophisticated. So it's a widespread. But it's about part of our activities and our theories of change. We're the vehicle for the resource, but we're also into capacity building and technical support. So some of the things that we've done, we've had a number of capacity training. Some of it has been in performance management with the Excellence in Missouri Foundation. That's our Baldrige folk in Missouri. We had David Hunter in to talk about theory of change and performance management. And we had Kate Robinson in just during our 2012 RFP kickoff meeting and showed the Saving Philanthropy movie. So again, we are really working with our agencies to help them build those skill sets and to change the mindset, the culture, and they're hungry for it. When David left, they were like, could we have David back? That was awesome. And he wasn't any more happy or pleasant. I mean, he was honest, okay? He's honest. And I appreciate that. I appreciate that. And so did they. Because deep down, we know that's true. There's a lot of it we know that's true. So the other things that we are doing, we've created learning collaboratives. So the 44 agencies, in order to get them out of the silos, we meet based on service categories at first, and now we're cross-pollinating it. We want a network of really tight agencies that are working on using discipline and working on shared common outcomes. Again, we have to deliver on the promise. So this constant conversation about what's an indicator, what does it mean, we're going to have that conversation for a very, very long time. The other thing that we've done, and the board has been so supportive, is investing in the workforce. We just invested $1.2 million in training the workforce in the evidence-based practice of trauma-focused cognitive behavioral therapy. We have one agency that can produce outcomes to fidelity. They've got a 6-month waiting list. So that information came from the field. It wasn't like we threw a dart. We're listening to our investment partners. We're hearing what the need is and putting in what we need in order to have a well-equipped workforce that's really going to help us whittle down on these big societal issues that we're holding ourselves accountable for. So we're just getting started. We have a number of the agencies that we're working with that are becoming Baldrige organizations. They're learning more. They want to do more. And they really want to understand how to not do harm, and if they are, to get quick about it, understanding it, and doing something that's going to help and make a difference. You know, in the end, in just talking, it's quite humbling, really, to see where we've come from through the campaign. And that was the hardest work I've ever done. And that's why it's so important that we really protect it and protect that resource and protect our children, because that will protect our future. We have come a long way from blaming others for mental illness. We know things through groundbreaking discoveries about the brain and how to treat it and how to get people back into life and live in. Taxpayers. And people, now here's the call to action, you know, people are counting on us to know this stuff and more. So I just really appreciate being here. I really appreciate being able to share the story and just letting you know that as a funder, as an investor, a social investor, I am going to get into the trenches and work with my people because I absolutely know how to understand that. I know what it's like not to have a funder, have that resource. And people, they come back to us and they say, this is like a partnership. We can't hardly even believe it. And it is a dream come true. So I'd like to close with a quote and remembering, whenever someone has found the audacity to live life more deeply, more courageously than before, they hold the door open for anyone who tries to follow. There's so many people here today that we owe a great debt of gratitude for their willingness to hold the door open for us to follow. And I thank you for your attention, and I look forward to learning from you. Thank you.
Questions for Kate?
I just wanted to find out if she could repeat the performance management approach to Malcolm.
Malcolm Baldrige, B-A-L-D-R-I-G-E. It's a national website, and then generally each state has their own individual program.
The questions?
Y'all just blown away. $35 million a year, it is pretty awesome. Yeah, absolutely.
Anything else? Nope.
Yeah.
Kate, can you speak to your strategy or any success you're having in influencing other funders in your community to think in a way that's similar to the way you think? You spoke to the way in which the funded organizations feel like they're benefiting from your collaborative approach. I imagine that that's relatively unique in their experience, as it is in many of the nonprofit sector. What do you find is persuasive and compelling when you're in a room with 10 other funders in your community and saying, this is how we do it, this is how it's working for us. Give us a sense how that conversation is going, what's working, and what some of the impediments are that you're still trying to overcome.
Sure. Excellent question. We're new, right? So the agencies themselves, the 44 agencies, have made it no secret that they really like what's going on in terms of our relationship and the collaboration that we have. So just by virtue of them talking to the other funders in the area, the word's out. One of the things I'm doing is I'm working to get on their boards. I've already applied to start being on those boards, and we are having the conversation about being more strategic in terms of funding. I mean, if we've got $35 million for children and adolescent kids and teens, you know, why would you keep funding that? You know, there's things that we can't fund, so let's be more strategic. Honestly, we don't have just unlimited resources. So the conversation is, it's started, and you know, now there's in all this collective impact. I mean, you know, the buzzwords go on and on and on and on and on. The real issue is walking the talk, doing something different. And you know, we're no different than any of the other people. I mean, it's hard to change. You know, you're on a road, and heck, you could be driving off a cliff, but you're on the road. And so that conversation has to be continuous. I think we have to work to infiltrate those, again, getting on boards and really stay connected to the community in order to get the community the best services possible. It's working with the hospitals. It's doing all of those things. So the work is continuous. But that commitment, you know, that determination is there. And I'm telling you, if we could win that campaign, we can do anything. Even maybe change the mindset of some of those long-term funders. Yes.
Kate, speaking as a funder, could you tell folks, first of all, will you invest in any provider in your area that provides services to children? And if not, what are your selection criteria?
Sure. We do not fund everybody in the area. The board has set the criteria. Our business model is the Malcolm Baldrige model. So our application looks at their leadership. It looks at how you collect data. It looks at your program. It looks at every aspect of the information. In essence, when you finish the application, you actually have a theory of change. And the question, you know, you're rated. We built a performance assessment tool, the PAT. And so when we look at an application, number one, you have to provide mental health and substance abuse services to the target population. You have to be accredited. You need to have some experience with the target population. I mean, a lot of people say, hey, well, that's a new funding source. Maybe we'll try to do that this year. You know, again, the whole mission creep. And we've been in the field. You know, I mean, we have been providers. So, you know, we get it. We understand it. So the criteria is very targeted. We are holding ourselves accountable for some big social issues. But if you can't help us whittle down on those, we can't fund you. And that's hard. And I want to tell you, the beauty of having the theory of change is you learn to say no very well, so you can say yes equally as well and feel confident that the promise that you made to the folks out in the voter, you're going to be able to deliver.
Kate, I'm wondering if you have stopped funding any of the 44 groups that, or you see that as a potential outcome as part of the work that you're working on.
Yes, it is a potential outcome. I mean, we're really looking for an organization that can help us whittle down on those community-wide outcomes. And all of these documents are on our website, and the website is keepingkidsfirst.org. We absolutely will, and again, we've just gotten started. This is our first cycle. We're going into our second cycle. And there were organizations that we're not probably going to be recommending some of their programs. But absolutely, if you can't, and we measure, one of the things I forgot to talk about is we have an internal scorecard for ourselves, a balanced scorecard that we've just begun to help us understand what our critical success factors are and how to measure and monitor those for the board. And we also have a balanced scorecard for every agency that we fund and we invest in. And so we're looking at that agency's engagement. You know, how willing are you to come to the trainings that we have? How willing are you to come to the collaborative, learning collaborative? Did you even sign up for the free training that you got in evidence-based practice? And there's a lot of people that haven't. And I mean, again, those are the kinds of things that we're measuring and monitoring, and we'll feed that information to the board. So when it comes time to looking at funding an organization, who do you want to fund? Who do you want to work with? Those that are coming and showing up, or those that aren't? It was the same thing in the campaign, you know? There were 14 agencies that were really rocked it, you know, and the whole community wanted to get funded. So again, and it really didn't have anything to do. It's just your core competency. And we're not really looking for every agency to have every core competency. We're really looking at building a really tight network of capable agencies that are well equipped to really help us knock those things down. And that's another really big thing, because you think that would be easy. You know, you show up to the meeting and you know, I'm an agency that I provide psychiatric care to the really seriously emotionally disturbed. I don't do drug and alcohol very well. But because I've always been used to serving whoever showed up my door and tried to do everything so I could keep the resource, I didn't refer them on to the drug and alcohol people down the street. We're trying to break that mindset, because we're really looking at trying to do the best for the folks who show up at the door, for the client, for the customer, well, the client, the patient. And without that kind of mindset, you know, to really looking at what's best for the client, we're not going to get there. So I hope that answered your question.
I have a question to ask you to go a little bit more into the getting the agencies together and shared outcomes, and how you see that evolving. Have you done that just once, and how the conversations have been? How's that working?
Sure. We started in 2010, and as soon as the allocation, the investment went out, we started working the learning collaborative. So we provide transitional living, we provide 30-day shelter, we provide school-based prevention services, drug and alcohol services, counseling services, psychiatric services. So some of those tend to just fall logically together, that you get those folks together to meet. We meet every 8 weeks. We, again, sit down and they build the agenda. I mean, we did first. This is what we expect. This is what we're hoping for. How about you? You run it like a group. What do you want to get out of this? And then you build an agenda, and you get them engaged. And, you know, and again, people will say, even with the evidence-based training, which, by the way, is like $7,000, the board members should close their ears, per person to have this training to fidelity. It's huge. Number 5, you can't afford to do this. And they will say, well, you know, the time it's going to take. It's very short-sighted. I mean, you know, long-term, you're going to really be able to do some unbelievable things. So really helping them to set that aside. Yeah, you have to invest something in this. And being willing to have the conversation with them. I've worked with these people in the same community for a very long time. I don't have any problem calling another executive director and say, I don't get it. Why aren't you showing up? Help me understand what's going on. But I want to have that kind of real conversation. You know, I don't want smoke. Because you know what? We don't have a dime to waste. We don't have a minute to waste. So I'd just be real with me. I'm going to say, well, I just don't see it as important. Okay, no problem. I'm just going to scribble that down, because my board members are going to want to hear that. And then that goes into making a decision. Are you the kind of partner that we want to invest in, that we want to work with to really help us go get it and do it and make it happen? I am going to the networking thing this season. Yes, ma'am. I am.
Thanks, Kate.
Thank you.